child. Okay, so how to determine the performance? So go back to the scoring. Yeah, here. Okay, go back to the scoring sheet, backside. Go to the second last row. You will see degree of normality or abnormality based on total score. Second last. Okay, you will see degree of clear. That's it. Yeah, second last. What? Yeah. All of you are clear? Yeah, you will see degree of normality and abnormality, okay, based on the total score. And that you have to see that, and it is divided into less than 4 months, 4 to 8 months, and 8 months and more. That means 4 months category has been given. Clear? Less than 4 months, birth to 4 months, 4 to 8 months, and 8 months and more. So based on that, your total score of the baby, and you match. So whatever total score come, you will get normal, transient, or abnormal. And for that purpose, you have been given a range of score. So whatever range of score your baby is getting, you match with that, and that is the performance of your baby. Clear? All of you clear? If you don't ask question to me now, and if you sit with the baby, more confusion will come. You will have confusion, baby will have confusion, you cannot understand anything.
I'm still confused about after I finish all,
Yeah.
how I calculate it when I
Yes. Okay, I am coming slowly. You go the way I am taking you.
done.
Okay, if I go the way you want me to go, then everybody, so many brains are there, it will be too much confusing. Okay, so I'll go step by step. So it is like you get the total score, you categorize the child, degree of abnormality or transient or normal. So this is what you will get. 3 age bands, less than 4 months, 4 to 8 months, 8 months and more, you will get these three category. Now, what to do? When to categorize? Down to that you see category of abnormality. Down to will see category of abnormality. After that, okay? If your baby is coming normal or transient, no need to use the last category of abnormality. Okay? If your baby is coming abnormal, then only you will use category of abnormality. Okay? Okay? Okay. Now this category of abnormality gives you to choose the category. You can choose spastic tetraparesis or dyskinesia. You can choose spastic hemiparesis. You can choose spastic diplegia, or you will choose hypotonia. So these are the 4 categories you can classify a child. All of you clear? Anyone has any questions? Okay. So now after this we come to some statistics. Okay. So what is the inter-rater reliability? Inter-rater means between two testers. Suppose you will do and I will do, what will be the difference between us? Clear? That is 0.97. That means 0.97% your evaluation and my evaluation will be reliable. Only 3% we will have differences. Is that clear?
Yeah.
Between two testers. All of you clear? Next, test retest. What is the test retest? Suppose I am doing the test baby now, and 1 hour after I will do the testing again. Okay? That reliability is 0.95, but that means between two different morning evaluation and evening evaluation, 5% difference may come. And that is where so many staff has problem. And I am seeing this, baby is they are saying this. Why it is that? It is happening like this because baby has got different state of emotion. We cannot tell baby you have to do like this. Baby is a baby for that matter. We can tell adult that okay, you did before like this, now you are doing like this. Why you are doing? For the baby we cannot say. So that is called test retest reliability.
But is it should be like when the baby in a specific state, specific
Yeah,
mental state?
we will talk. Absolutely, it depends. Okay. Now, predictive validity. Can the scale predict? We spoke about that. Individual factor. For the factor like spasticity and head and trunk, 86, 87.1. But for vestibular, legs and French angle, it is not available. Means you can do the research. If any one of you want to do, you can do the research. You are free to do. That means predictive validity for the spasticity and head and trunk is proven. Predictive validity for the vestibular, legs and French angle is not proven. It is open for research. Okay? Is that clear? Okay. Now, with respect to age, what is the predictive validity? With respect to 3 to 4 months baby, sensitivity of this scale is 84.6, specificity is 75.6, positive predictive value is 60%, negative predictive value is 91%. That means 3 to 4 months the scale can predict positively that 60% probability is there that your child will have problem. Okay?
Good question.
You will be, what sensitivity means, is the scale sensitive to identify neurological problem in the baby? Yes, it is 84% sensitive. Specific, can the scale be so specific about the problem that yes, baby has problem in the head, baby has problem in the legs, baby has problem in the vestibular, like that? It is 75%. Negative predictive, that means some children you have identified abnormal today or transient today, okay, that baby after 1 month probably can turn out to be normal. That is called negative predictive value. That means there are chances that in early age scale can identify a baby as abnormal, but that baby possibly after 1 month can turn out to be normal. That is called negative predictive value. Okay, that is within 3 to 4 months. But when you look at the 6 to 7 months, all these percentage increases. That means probably highly chance that after 6 months the sensitivity, specificity and positive predictive value all increases. That means as the baby gets higher with the age, the information coming from the scale will be much more reliable. Okay? Is that clear, all of you?
Very clear.
Could you please re-explain the negative predictive value?
Negative predictive value is some babies at the younger age you identified as having problem. Okay? Later on, the baby turned out to be normal. Okay? What will happen is practically is that you may, okay, I have to go to the item wise. Okay. Suppose you want to identify tightness in the muscles. Okay. So easy thing is, look, go to the item number 3. It is heel to ear. Okay. Heel to ear, when you look at this, it is from the 90 degree supine position. You are going to the taking the leg to the 90 degree. Okay. Now some babies will show you 90 to 100 range. Some babies will show you 60 to 90. Clear? Some baby even in higher age will show you 90 to 100. But the baby can be okay. It is possible because hamstring tightness is a real fact across the population. You need not to say that all the children should have flexibility. Similarly, the leg abduction. Look at this. How many of you can go 180 degree? Probably very less unless you are practicing. Clear? That means there are many children who will stay between 100 to 130 degree. Correct? And many children can stay between 110 to 150 degree respectively, leg abduction, popliteal angle. Not all children will show you full abduction. But when you look at the Down syndrome, you will see heel to ear touching the head, leg abduction going to 180 degree, popliteal angle also goes to 180 degree. So you will have a situation like this. Is that clear? So every scale, these are called psychometric property of the scale. Any such scales are there, the scale must present these information, and that is how you can say that whether the scale designers were really honest about the findings that was coming from the scale or no. And that information you get only through these statistical information. So as in this slide you are noticing that higher age you have scale is more sensitive to pick the correct child. Younger age, can we say that a baby is newborn today, the baby will not become prime minister of a country? That baby can become prime minister of a country tomorrow. But can we really say that this baby will become a prime minister? No. But if baby became prime minister, then you start building a story. Oh, baby was like this in the beginning. Then the baby scored good marks in the school. Then baby went to the sports and he was playing very nicely. Now the baby is running the country very well. Like that. So the scale should be able to predict that. And then for all those information, what type of study you need? For such information you need longitudinal study. These scales are made based on cross-sectional study. If you know the difference between two types of study. Cross-sectional means at one point you are seeing that baby and then you are dropping the baby. Longitudinal study is same baby is being tracked till 18 months. Okay, I will present you both such situation practically how they perform. Is that clear at this level?
Yes.
All of you? Okay. Now internal consistency. Internal consistency is across the different ages. What is the information findings? Whether it is consistent or no. So for 7 months or less, it is 88%. For 8 months and more, 93%. And for overall, it is 0.91. That is 91%. That means internal consistency of all the items included in this scale is very high. Any psychometric evaluation tool having internal consistency more than 70% considered as highly trustworthy. Okay. Then concurrent validity. Concurrent validity is comparing a scale with another scale. Okay. That concurrent validity is not available in the manual. That means this scale hasn't been evaluated against another scale. You can do that. Construct validity not available. Means whether construction of the scale has been validated. No. I told you 4 evaluation tools were used to design this scale. Okay. But after designing the scale, did they build the construct validity? No. Construct validity is done between me as a physical therapist, you as a pediatrician, another one as a neonatologist, another one as a neurologist, like that across the people who is working with the baby, and then you would say that okay, construct validity is correct or no. That means all of us should, like that you can across the different professionals, you can do a study and you can design the construct validity and publish it. Okay. Okay. So what are the practical use? Is that clear so far? Okay. The practical use is for the clinical application. It can be completed in few minutes. Okay. And both factor scores and total score you can compare. Because down to the line when you look at, go to the first page. Look at, you will get a factor score down. And after factor score you have total score.
Yes.
Okay, so you can compare across the factors, different age point, how the child was performing, as well as you can compare the total score. Factor score cannot be used to conclude anything. Total score only will be used to conclude something. Okay? Okay. So these factor and total score you can compare from one evaluation to the next evaluation, You can compare one infant to another infant, and you can compare infant of one type of condition like child who has got IBH with another condition child who doesn't have IBH. Okay, so you can compare how they all are performing. So like that comparison can be done across the factor score and across the total score. Is that clear? Okay, most important. If any scale is there, it will have a limitation. No scale will be without limitation. Okay, so what limitation it has? The infantile scale scores lower even if child shows higher level of performance, higher level of response. How to understand? Okay, so look at this. When you look at this item and you have a baby who is say so 6 months. Okay, so now when you go back to the page and you have a 6 months old baby, 6 to 6.9. Okay, 6 to 6.9. Yes. And you look any item. Okay. Now, if it is 6 to 6.9 age, you expect say so. I just, for example, I take item number 2. Okay. Item number 2 is having 45 to 60 degree range should come for the start sign. Okay. Item number 2 belongs to start sign. So it should come 45 to 60 degree. If your baby is scoring 60 to 85, what does it mean? Does it mean that your baby is so much flexible? Answer is yes, it is flexible. It means that baby doesn't have any tightness in latissimus dorsi muscle? Possible? Can it be considered as a good? No. So, even if child is scoring better, you think so it is good to have a good flexibility, scale will not allow you to give higher score. Is that clear? Any confusion?
No.
You can ask.
I
I know.
cannot score it as 9 months.
I told you 6 to 6.9. The way I say, you have to stick to that.
So maximum
If you
6
jump,
minus
you will
maximum.
get confused. Okay. So I come to you. It is 6 to 6.9.
بس دي حاجة كويسة بس اندر استيميتنج كده
And we
ده انا
expect
اوفر استيميتنج
picture matching the age. Okay? We expect picture matching the age. So picture matching the age will get 5 score. But your baby is showing you 60 to 85.
يعني هو ده
Okay?
ايفن لو شكله
Scale
أهي،
will
أهي.
not allow you to give 5 score.
One stage away, plus or minus.
Is that clear? You are clear?
One stage away, either plus or minus.
ايوه بس هي الفرنج دوت من
ها؟
ما هي دي
60
plus or minus هتبقى
Sorry?
تحت برضو 3.
That is called as one stage delay.
One stage plus or minus.
All of you clear? I'll come to that point.
As mentioned here, if it is one plus or minus.
Yeah, so your
It is,
baby.
لا, this one. If it, one
One
stage away,
or one stage-
either to the right
Yeah,
or to the
yeah.
left.
So you will score 3. Yeah.
Doctor, you mean we cannot give
Higher
1.5?
No. Your evaluation will come wrong.
احنا بعد كده هنشغل سكورر.
If picture matching the age, it is fine. But if it is one side left or one side right,
خرب.
So 0.
it will come 3.
And it's supposed to be exactly this age, 25 to 60. If it's more or less, that means it's 3. Because it's
Okay.
Yes. One stays left or one stays right.
بالك لا كنت مش شكله يعني خلي بالك حاسس بيكم بالنسبة
Okay. What are the other limitations? believe me, these limitations are not written in the manual.
Hmm.
Okay? You identify this
Practical
lots of
points.
practice. We are coming.
Can you just repeat the very last part? The one you said.
Okay.
The
I
one you just
said
mentioned?
if it is child is age is 6 to 6.9 in that age, clear? Child should show you 45 to 60 degrees scarf sign, clear?
Yes.
On examination you are finding 60 to 85,
Yeah.
higher, means child has more flexibility, clear? In that case, scale doesn't permit you to give higher score.
No.
Because it is one stage forward or one stage backward. So it gives you 3 scores. You have to give 3 scores.
Lower. Up.
Why should I use?
That is the way scale has been designed.
How we know this is first stage or second stage? Two stage, I mean, sorry. First and
تدخل إذا هو تخلص وتطلع ده مش كويس.
شوفي هو ده هنا المفروض ايدج جروب دي هنا. one stage only to the right or one stage to the left يبقى will be 3. طب لو هو المفروض ايدج جروب دي وخدي two stages يبقى خلاص يبقى ياخد 1.
Okay, clear.
Clear?
Excellent.
No, it is good to have confusion now.
خلاص عنده later. بس.
Yeah, you know, all questions are come.
Excellent.
Slowly.
It is coming one by one.
Yeah, it has to come one by one.
Good, okay. Just limitations continue. Doctor, talk because they will continue to talk. They will continue to talking. Let us please continue. Good.
Okay, can I have your attention? Is that clear? All of you?
Yeah,
Clear?
yes.
Mostly.
Any further, whatever you are observing, okay, any further questions are there, you can parallelly address. More complications have to come. Okay. So when you look at the category of abnormality, okay, what you found is tetraparesis and dyskinesia is categorized as one. Tetraparesis means spastic quadriplegia. Okay. Tetraparesis means spastic quadriplegia. Clear? Clear? All of you? You have to go the way I am taking you. Go to the category of abnormality. Okay? So here what you will see is tetraparesis and dyskinesia is categorized as one. Okay? So there is no option for ataxia or ethetoid. You cannot. Okay? There is no option for spastic paraplegia. Okay?
Die
And
only.
no way any deformity will be categorized through this scale. So that means, question is why? Why they clubbed dyskinesia, that is ethetoid and ataxia together, they didn't separate? Because newborn all the movements are ethetoid movement. Newborn all the movements are ataxic movement, it is discoordinated. It doesn't have any voluntary control, so they cannot categorize this. So they did this very intelligently. However, it is my opinion that they could have categorized dyskinesia as a separate category and spastic quadriplegia as a separate category. But that you can, anybody who want to give your life, you can redesign the scale. Okay. But these are the those people who want to do research. These are the ideas I am sharing with you. Okay, and you can design the research because you have got lots of sample here. Okay, is that clear? So deformity cannot be categorized through this scale. Ataxia and ethetoid cannot be categorized as an isolation. Spastic paraplegia cannot be identified as an isolation. all these are categorized as dystonia and quadriplegic as it together. And then you have a diaplegia absolutely, or you have a hypotonia. Okay? Okay, I move to the next. Okay. So what present study says, can you trust these information, whatever we have presented? Okay? So this is a study done in 1991, okay, on infant, and they found factor 2 vestibular function for predicting cerebral palsy, 87.1% accuracy. That means for 87% you will be accurate if you say a child has cerebral palsy through this scale. And factor 1 as spasticity, 86.8% to say a cerebral palsy. That means you can absolutely confirm a child who has cerebral palsy or no.
But I cannot choose only one factor.
Huh?
I cannot just depend on one factor.
No, I'm presenting what are the studies. I'm not
I
presenting.
can choose cerebral palsy, spastic cerebral, I can choose like that.
You can choose like.
Okay.
But that selection is based on what factor? That question will come. The selection cannot be based on individual item. Okay? It will be based on factor. So the factor 2 and factor 1.
Vestibular function factor 3.
Huh?
Factor 3. Vestibular function.
Yeah, correct.
hidden the
Okay.
Okay?
Yes.
So factor 3 vestibular function and factor 1 spasticity will be used as a cerebral palsy diagnosis.
same probability percentage.
This is a study in Korea. Okay?
1997.
I am
This is a
sorry.
study done in
Sorry, doctor. It is factor 3 or factor 2 because previously you said predictive validity. Factor 1 it is 86, factor 2 87. Others are cannot.
This is specific to cerebral palsy. Specific to cerebral palsy. I'm presenting.
It is factor 2 or factor 3.
3 because when you mentioned before, factor 3
That's why I accepted that it is an error.
error.
In which?
Factor 3.
In 3, not the vestibular.
Yeah.
Okay.
Is that clear?
Yes. Okay.
Right. Now this is a Korean study. These are done on Korean children. Okay. Now what they found is that they did the analysis of infant at the 2 years outcome. Okay. They analyzed at 2 years outcome, and what they found abnormal. Okay. In almost initial infant examination grew either into abnormal as a cerebral palsy or minor neural dysfunction on follow-up. That means the children who were categorized as abnormal, and those were 29 numbers, okay? Out of that, 26 turned into cerebral palsy and 3 turned into small neurological dysfunction on follow-up. It means that in another study, they could correctly predict cerebral palsy child as a diagnosis. Okay?
90%.
Those who are abnormal. Okay? Then normal. You see, look at here. The children who were considered as normal, they continue to be normal in subsequent follow-up. That is 12 children. And in the transient group, 29 were there. They had variable outcome. 9 turned out to be normal. Okay? No, sorry, 9 turned out to be cerebral palsy, then 6 turned out to be minor neurological dysfunction, and 11 turned out to be normal. That means there will be a transition from either side. That is, either they will be normal, they will be cerebral palsy, or they will be having minor dysfunction. Okay. So, what was concluded? Normal infantile result can be used to reassure parents of the risk children and recommend for early intervention program to the children who is categorized as abnormal. So once you find out the child who has abnormal, you can recommend them for therapy. Those who are on transient, you can decide the date of your subsequent evaluation. If you have suspicion, it can be 2 weeks, it can be 1 month, it can be 2 months, up to your clinical decision making. Okay, another study. they did the validity and reliability, okay, on detecting the gross motor dysfunction. It was done in Iran, okay, and it was published in Child and Healthcare Journal, so it is a good journal. Okay, what the beauty is that they analyzed 6150 children,
Sample size.
okay. Out of that, 3,000 plus were female, okay, and 3,000 plus were male, and the age range was 4 to 8 months, okay.
Teens.
And between urban and rural, it was 6,000, okay. 5:1 ratio was there. The transient group infant, we are divided into normal and abnormal after 3 months follow-up. What they found, the infant is valid for normal and abnormal group with 90% sensitivity, 83% specificity, 79 positive predictive value, 93 negative predictive value. So reliability overall was 0.9, that means 90%.
Good.
It means that why I presented this study, because you belongs to Arab nation, okay? Iran is also an Arab nation, okay? You can say Persia, but for us it is Arab nation. So we believe that culturally, the children of Arab country has the same kind of a upbringing, okay? Under that perspective, when this tool is able to identify reliability of 0.9%, that means on your sample you can use this scale. That is the message. Okay, yeah, because most of the scales are designed on American population. So the question is whether American population sample would be suitable for our population or not. That is the question. So based on that we analyze. Korean study we presented because this is Asian peninsula. So that means for the overall all the countries' children, you will find that they will have a higher reliability, so it can be easily used for all the sample. That is the one. So that is how they said that it is a reliable measurement tool to identify gross motor delay in the children. Okay, so another study. This is in the Chinese, okay. They did the analysis 3, 7 and 10 months, and they found that Infinib is a simple, time-saving, favorable reliability and accepted validity at 10 months of age for both preterm and the full-term infants having high risk for developmental delays. So means that you can very happily use this, because at 10 months whatever information you are coming, it will be acceptable in terms of your clinical judgment. That is the message. Okay. This is another study which was done in again Chinese population. What they did is they had 129 sample, okay, and what they found is that the Infinib is a screening tool and validity measurement tools for early detection for gross motor delay in preterm infants, and their predictive validity for the 3 to 4 months and predictive validity for 6 to 7 months is presented here. So that means as the infant grow higher, the scale's reliability increases. Younger age variation will come, okay? So younger age children, when you see the variations, please increase the follow-up examination frequently. Higher age, when you see the variations, you can have little prolonged follow-up time for the evaluation, okay? This is another study on the Infinib. It was done in Colombia, okay? And then they found at 3 months sensitivity is 62.2, specificity 76.1. At 6 months, once again 77 and 74. But at 9 months it is 77 and specificity is 91%. That means higher age, the Infinib will correctly predict problem in the baby. Is that clear? Okay. This is another study. So what they found is that they found that asymmetric movement, abnormal muscle tone, posture and reflexes are highly predicted through the Infinib, and they did the sample analysis on the children who had plagiocephaly, positional plagiocephaly. So that means if you have a child with the positional plagiocephaly, you can actually use the scale to identify if they have problem or not. So conclusion. Okay, conclusion is at 3 to 6 months Infinib application, it is good to identify infants for the early intervention. Specificity at 9 months is very high, means abnormal result is likely to be a true positive findings. That means child continue to be abnormal and you can be serious about the baby for the therapy. Then it is a reliable measurement tool for the gross motor delay. So if you see a motor delay in the child, you can trust this scale to be a reliable scale. And the more the mature infant, when you do the infant, the better will be the discriminant ability of the infant. That means at higher age, you can discriminate the findings of the children pictured in terms of developmental disorder much more accurately. So, to predict cerebral palsy vestibular function, 87.1 accuracy and the spasticity is 86.8% accuracy. So, now we come to the practical examples.
أيوه.
Okay, any questions?
Yeah, I have,
Yeah.
what do you mean by space number one? It's mentioned carefully.
We are coming to that practically. Okay,
It is long or
it's long.
we can take some
Yeah,
rest
we
or
are
5
going to
minutes.
break.